Welcome back to Mental Health and All Things Mommy. I'm so glad you've joined me for today's episode because we're diving into a topic that every mom who has had a vaginal delivery needs to hear. Thanks to all my viewers just far. I'm excited, and truly grateful. In my introductory episode last week, we discussed three main areas: self-care, guarding your mental health, and mom guilt. These topics were specifically chosen as they will show up in our other topics we will discuss, including the one for today. Today, we are discussing what to expect during your recovery and how you can best take care of yourself in the days, weeks, and even months after childbirth. This episode is for all you moms out there who are navigating life post-delivery, dealing with both the expected, unexpected parts of recovery. Whether you're a first-time mom or adding another little one to the family, each birth experience can be different, and I'm here to give you the insights and tips to make your recovery a little smoother. Sis, I'm starting with the Sitz bath that mothers have to make a part of their routine for the first week of the baby being born. No, wait, let me behave. I'm not starting there. Let's start at the immediate recovery after delivery. So we're going to look at what happens right after you've delivered your baby vaginally. First of all, congratulations, mama. You've brought life into the world. What a blessing. We thank God. And that's no small celebration. But as soon as you give birth, your body immediately starts the healing process. That has and continues to be just like unbelievable to my mind. So after delivery, you may experience the following right away: postpartum bleeding or lochia. This is completely normal. It's your body's way of shedding the extra blood and tissue that supported your pregnancy. It can be heavy for the first few days, like a very heavy period. That's normal, and then it tapers off over the next few weeks. Don't be alarmed. If you see clots, just keep an eye on the size, and if you're unsure, always ask your doctor or your midwife for guidance. The second thing you'll experience after the lochia, which is the postpartum bleeding, you might feel cramping as your uterus begins to shrink back to its pre-pregnancy size. These can be mild or feel like intense period cramps, especially when breastfeeding. The more kids you have, the stronger these after pains tend to be, but they usually subside within a few days. The next one is the perineal discomfort. This is where we're getting into the Sitz what? So here what, guys. If you had any tearing during delivery, this area will be quite tender. Even if, for instance, to get the baby here, the doctor had to do a small slit to help the area to be stretched enough for you to bear the baby, this area also will be tender as a result. So you may feel sore, swollen, or even have difficulty sitting for long periods. But there are ways to ease this discomfort, which we'll discuss in a minute. I am dying to get to the Sitz bath section because, guys, trust me, it was the best thing, but also the most alarming thing because you're just so overthinking it. But let's continue. So the perineal care and managing soreness. One of the biggest questions most moms have after vaginal delivery, including myself, is how do I take care of the perineal area? Whether you tore or not, the area will be sore and swollen, and you'll want to make sure you're taking care of it properly to avoid infection and promote healing. Here are some tips for perineal care. So you have the Sitz baths. The Sitz what? Guys, so it's basically sitting in a shallow bath of warm water for 15 to 20 minutes a few times a day can help soothe soreness and promote healing. If you had stitches, a Sitz bath can feel like a lifesaver. Trust me. Alright, I paused earlier. I'm here again with the Sitz what? But nah lie, guys. Nothing they told me could warn me enough like Sitz what? And every gyno and midwife just talking so fast like it's nothing, and why are you making a big deal? Like I couldn't understand. It is a big deal. A mother's postpartum journey for those first few weeks is intense because it has so many moving parts, including this having to deal with the area being sore and where healing to the body comes in. And girl, they ain't telling me the full truth. They ain't telling you the full truth, and I'm here to give you the full tea. The full tea. Because trust me, they say mothers don't feel their true self until 2 years. God is so good, because most mothers are going back to work within 3 months. A round of applause, guys, for the mamas. It not easy, you know? You see them go through? Me, I'm a mother, and I must say, I rate them 100%. I was so young to this whole natural birth and what comes after. You must be wondering, like, why I'm talking about this so much. But trust me, I remember going through my entire pregnancy, and it was closer to the end, like maybe 30 weeks. I was being told to brace for tearing sore in the perineal area. I didn't even know what that was initially when they were talking about it. And that, you know, tears during natural birth, I know what they mean. And, I'm like, tear how? Tear where? What do you mean? And I lie, I was scared when they explained the possibility of what's properly referred to as the perineal tear that ranges from a 1st degree to a 4th degree. At times, the 1st degree, you do the sit bath still to soothe the area. It would still be swollen, but it's not not anything that you need stitches for. But from 2nd degree, sometimes up to the 4th degree, I don't even want to tell you what the 4th degree is. Trust me, I'll leave you to research it, and I'll leave some tips, and I'll leave some info in the box below so you can do some further reading. But I was like, oh no, here we go. Ain't no turning back now, because I'm like 30 weeks pregnant. What am I going to do? I'm just going to have to brace for it. So all expecting mothers, or if you have a friend of an expecting mother, please listen and share, because one thing with me is whatever I learn, I want to offer the same support to someone else, and even earlier, so they could prepare accordingly and for it not to be a blatant shock. So first things first, not every mother who gives birth naturally, vaginally, will experience a perineal tear. You have some doctors or midwives that are great at guiding the baby out without a tear. You will still be sore, and a sitz bath will still be necessary, but you wouldn't be in need of stitches. While other times, the preparation before giving birth helps. Yes, I did say preparation. Please take notes, mommies to be, and for the mothers who have experienced it without proper advice. So, like myself, much heart and comfort to you. Here we are, guiding the other mommies to be. So, in preparing for natural birth to prevent perineal tears, you can massage the perineal area with your fingers to help get the skin ready for the stretch. It will undergo using natural oils like coconut oil. And, of course, you keep it right in the area, the perineal area, not inside or just on the outside in that section. And as I said, in my box below, you will see the articles and stuff that would guide you to where the area is in the event that you don't know. Yeah, so you'll be getting it ready for the stretch using natural oils, as I was saying. And as you know, hubby can be of great help in this section while you help to massage the area and give you the support you need as you prepare. Research actually shows that this is proven to be quite helpful to prevent tears. For the mothers who have experienced perineal tears from the 2nd to 4th degree, as I said earlier, the sitz baths is your friend. Sitz bath should be done twice a day in warm salt water. So you have special sitz bath that can be placed on the toilet to be convenient to sit, or the real Jamaican style is, you just get a suitable pail, tub or basin that covers the perineal area when you sit so that the heat is able to penetrate the area, and the salt from the water helps to heal the area and help stitches to dissolve or fall out. It's important to pay attention to the area, although it might be hard to look with your mirror because it might look completely different, but braving up, looking, you're able to see how it's progressing and see if you need to ask for extra help. There is also a spray that you can use. It must be recommended or prescribed by your doctor that helps to fully heal the area faster and more completely to minimize complications and infections. So the name of the spray is microdicin. What I don't like is that getting stitches to your most private and delicate area is not spoken about enough to give you the psychological support you need to go through it, to know that you'll be okay. Never let anyone let you feel that you're over-exaggerating about caring for yourself in this way. You deserve to be comfortable physically and mentally in this postpartum period. So, next step other than your Sitz baths, as I spoke about just now, is using a peri bottle. After using the bathroom, don't wipe. Use a peri bottle to rinse the area gently with warm water. Pat dry with a clean towel instead of wiping. Ice packs are also helpful in the first 24 to 48 hours. You can apply ice packs to reduce swelling and numb the area. Remember, if you're ever unsure about how to care for your stitches or if something doesn't feel right, don't hesitate. Do not hesitate to reach out to your healthcare provider. So our next segment that we're going into is the postpartum bleeding and the hormonal changes. So let's talk more about postpartum bleeding. As I was mentioning earlier, the lochia. This is completely normal and can last up to 6 weeks. Though it typically gets lighter over time, you'll want to use heavy duty pads at first and then switch to lighter pads as the bleeding subsides. And mama, avoid tampons during this time as they can introduce bacteria and increase your risk of infection. Just like how you prioritize looking forward to pregnancy and meeting the baby, you should also prioritize rest and relaxation at the postpartum period. Getting back on your feet too early puts you at risk of healing slowly, possibly postpartum hemorrhaging. So, be sure to pay attention to the different phases of lochia. That's bleeding after pregnancy, which is the healing phase of the uterus, to ensure you know you're healing well and healthy. I will also leave further reading material below for this. Pelvic floor exercises. Another valid concern for first-time moms is, will it go back to normal? The answer is yes. Also, with the support of Kegels and other specific pelvic floor exercises, the answer is a sure yes. Don't be worried. Gentle Kegel exercises can help strengthen your pelvic floor muscles, which may have weakened during delivery. I just feel that women shouldn't feel judged for wanting to ask these questions. They should be able to experience their emotions. It's a valid concern. Let's be mature and encourage these healthy conversations about our bodies. After all, we have just gone through so many changes as a mom. The least we can do is have the support with all our concerns in a safe space. If you ever, and I mean ever, need that support, email me. I'm ready. All ears. I personally didn't like when I wasn't able to level with much people and just be open and have your fears soothed with prayer and the truth. Remember, recovery looks different for everyone. Some moms bounce back quickly, while others need more time, and that's okay. Honor your body's pace and listen to what it needs. This is another key segment, knowing when to call the doctor. While most recovery symptoms are normal, it's important to know when something might be a cause for concern. If you are experiencing any of the following, reach out to your doctor right away. First, very heavy bleeding soaking through a pad in an hour or less. A fever or chills which could indicate an infection. Severe pain or redness around your perineal area or stitches. Any signs of blood clots or difficulty breathing. Your health is just as important as your baby's, and there's no shame in reaching out if something doesn't feel right. To all the mothers listening, I want to remind you of something incredibly important. Your body just performed a miracle. You carried life, delivered your baby, and now you're on the road to recovery. Be gentle. Be kind with yourself. Give yourself grace and take things one day at a time. Trust me. I hope you're listening to me, You're doing an amazing job. And if no one has told you today, you are enough exactly as you are. If you didn't get anything else from what I've said, these are the high points I'll be discussing right now. It's possible when you go to give natural birth to your child that your perineal area might become injured through a tear and needs stitching. Being consistent with your Sitz bath at least 15 minutes 2 times a day will provide the relief from pain you need and full healing. Mothers, do other mothers a favor and be honest about your experiences, even if not by saying everything, but it can provide insight and even prevent some things. Let's always keep it real with each other. Look at how much better we would be and grow naturally without a deception of perfection or that we don't have issues. We can learn so much by sharing. That's also another reason why I do this podcast, because I know what it feels like. So, before we wrap up today's episode, I want to hear from you. How has your postpartum recovery been? Share your experience in the comments below or ask any questions you might have. I'm here to support you. Also, if there's a topic you'd like me to cover in a future episode, let me know in the comments or send me a message. And as I always say, don't forget to subscribe and share this episode with another mama who might need some encouragement today. Thanks for tuning into Mental Health and All Things Mommy. Remember, you are an amazing mother and your body is doing incredible things. I'll see you in the next episode. Love you guys, and until next time, remember, where no counsel is, the people fall, but in the multitude of counselors there is safety. Proverbs 11 verse 14. This is the King James Version. The Mental Health and All Things Mommy is the community where there is no judgment, but only an atmosphere for love, learning, and affirmation. Be sure to connect with me also on Instagram at JuJo, and don't forget to hit that like, share, and subscribe button. I can't wait to have you join the community. Bye guys.